I'm Keri McDonough, and I lead the Patient Voice Consortium at Syneos Health. And we're a company that works with biopharmaceutical companies, large and small, across the entire drug development and bringing patients into clinical trials, but also thinking about clinical trials and then what it means for the real world communities that are accessing the outputs of these trials in terms of medications that are then approved for care in the real world. And today I'm here to talk about one concrete way that we can work today, and actually that's actionable today, that can make clinical care a little bit more inclusive. If we can jump to the next slide, please. So first, a quick review of why representation matters in clinical trials. First of all, clinical trials are often the only viable or the most desirable option for folks that are, especially in the cancer community, folks that may have exhausted other options, folks that this is the most appealing avenue for them. Also, research requires diverse bodies. Just because a drug is tested in, say, an average size, middle-aged, middle-class white man doesn't mean necessarily that it's going to, work the same way in a teenager or in other subpopulations, communities of color, basic, gender. There's all sorts of different factors that impact how we may metabolize medications, how certain, especially with the era of genetic medicine, how all of that comes into play. So at the end of the day, inclusion and representation in the trials really leads to an improved ability to offer equity to those that are seeking options today, as well as offering more representative information and more specific or targeted information about how the medication might work for somebody in the real world. And there are many, many, many barriers to inclusive research and inclusive clinical trial design. Some of these Courtney and Anna have already touched on. Trust is huge. Resonance and relevance in terms of the way we talk about clinical trials is enormous. However, that's not the only thing. Also, we need to look at eligibility criteria, and based on FDA guidance recently, there has been a lot of emphasis, much needed and long delayed emphasis, on looking at eligibility criteria and trying to make sure that it matches as closely as possible, while also preserving safety and the viability of the research endeavor, but making sure that that eligibility criteria really matches the real world population. I mean, today a lot of, for example, people with HIV/AIDS are not allowed to be in clinical trials. I mean, it hasn't been very long that there's been much of an emphasis on even having women be part of clinical trials in a concerted effort. And so that's another key way. But then kind of linking to what Courtney talked about in terms of finances and resources, cost is something that we don't talk a lot about when we're talking about clinical trials. And I think that's, and I'm not alone here, it's a miss, because as we know, cost is huge. It's unfortunate, but the landscape that we have, cost and resources are huge when it comes to people and how they're making critical decisions about life potentially altering or life-saving care, and how they're doing that in a very, very, in a period where they're already highly overwhelmed. And so I'm gonna turn to the next slide, which brings me to that simple sort of thing that we can, act on today in order to at least help. And that's the Clinical Treatment Act, which is an act that passed and went into effect at the very beginning of 2022. And what it does is requires Medicaid in all 50 states to cover routine costs of trial participation for Medicaid enrollees. And until this year, Medicaid was the only major US payer, so the only major health insurance provider not required by the federal government to cover routine costs. Medicaid has been an outlier because Medicare and private insurance plans have been required to cover these costs for years. So just want to take a minute to just explain what we mean by routine care. It's the cost that somebody would have access to whether or not they were in a trial. So regular doctor's appointments, emergency care, those are the things that they consider routine. It's definitely standard and expected that sponsors, so the companies or the institutions that are doing research, that they cover costs related to the study drug that's being investigated, as well as any additional tests that would go above and beyond sort of what they would consider regular or routine care. So now that we've got parity on paper, let's dig into what that kind of means for, who are the folks that are in the Medicaid pool. We definitely see uneven enrollment across populations. Nearly twice the proportion of Americans who identify as Black, Native American, or Hispanic are enrolled in Medicaid compared to the Caucasian population. It's also a population and a service that's been designed for folks with either lower incomes or higher needs. 1/3 of individuals with disabilities receive Medicaid. And a recent analysis shows that 5 million of the essential and frontline workers, and that's not entirely healthcare workers, but a large amount of them are also recipients of Medicaid. So if we can definitely see sort of an overlap between the two areas, the Medicaid population and the folks that have historically been left out of many clinical trials. Next slide, please. So it's great, right? This has passed, and that's really great news, except that we all know in the advocacy space, especially, that awareness is everything. And like any policy change, the Clinical Treatment Act, it's not a panacea, but it's a step forward. But the only way it's going to be a step forward for real is if it's implemented at the state level appropriately and as the authors intended, and also that patients are aware. And so we were a little bit concerned when it was getting to be the end of last year and we weren't hearing much about this at all. And asking around, colleagues, advocacy groups that we're working with. Yes, it was the advocacy community, largely led by ASCO and ACS and a number of others that were at the forefront in making this pass. However, now they're very much steeped in a lot of other areas to make sure that they're protecting rights that patients have earned and rights that the community has earned for patients, including some of the Medicaid expansion work. And so there really wasn't much going on from a communications perspective. And so we thought, okay, maybe we're just missing something. And so we thought, let's do a little survey to see what physicians are thinking or what physicians know about the mandate, and also, equally importantly, about the financial barriers that clinical trial participants might be considering. And what we found, the most startling thing was only 1 in 5 physicians were aware of the mandate prior to the survey. What we also surfaced was a lot of sort of misperceptions about why Medicaid participants may or may not be right fit for clinical trials, some misperceptions about the cost of care in general, and realize that there's a lot of work to be done there on the physician front, which is, touches a lot on what Anna had shared just previously. But also what this struck us was, okay, if doctors aren't aware, how in the heck are patients going to benefit? And so in this community, we know that, advocates can't always solely or even exclusively or often rely on the information that they're receiving from physicians. Patients it's sort of hit or miss, whether they're going to get a physician that's going to sit and spend the time that it might take to explain what it means to participate in a clinical trial. It's hit or miss whether or not their physician believes they're going to be appropriate and will even ask them if they're interested in learning more about a clinical trial. I mean, there's some really startling data about who actually gets asked to participate. And so we need to make sure that as much as possible we have more of a direct path to educating patients about what their rights are, which at the end of the day is what we're talking about. And that brings me to my ask for you today. If you can jump to the next slide. So it's really just about thinking about educating patients today on their coverage rights during clinical trial participation, trying to help correct any, lingering beliefs about Medicaid coverage that, because there hasn't been much in terms of education around this, correcting the, any lingering beliefs that, if you're in Medicaid, you're not going to have this type of care covered. And then you can access on our website some free resources that you can share. We have two backgrounders, one that provides a lot of details and some of the findings around physician perspectives from the survey I mentioned, as well as a backgrounder just going into the details around the Clinical Treatment Act, what it means, what it can do, what it cannot do, knowing that, like I said before, it's not a panacea, but it is an actionable, concrete thing that can help fix at least one of these gaps and help make that treatment decision process and whether or not somebody wants to participate in a clinical trial, help give a little bit more power back to the patient and their family who has to navigate these tough decisions, in order to protect and potentially, help to prolong and improve their quality of life. Thank you.